That historically, we see it today, especially in a down economy. People have lost insurance.
Hospitals are noticing trends when it comes to the U.S. economy. Good evening, I'm Jeff Smith.
And I'm Nicole Kahn. Thanks for joining us. More people are considering whether or not it's absolutely necessary before they go to the doctor, thanks to the economy.
Aaron Leedy has more now on another trend that hospitals are noticing, this one involving employers. Aaron?
Yeah, well, good evening, guys. Aside from more people heading to the doctor with no insurance, another trend, just as you said, involves employers. And President and Chief Executive Officer at St. Elizabeth Regional Health, Terry Wilson, says hospitals are seeing what he calls an increased utilization by employers of high-deductible health plans. And that means when you head to the doctor, you're going to pay more out of pocket. And as a result, there is a decreased volume in the outpatient areas of hospitals, and some patients might develop the attitude of, if I don't really have to go, I won't go. Wilson says more people are heading to hospitals with no insurance as well.
We've seen a lot of that historically. We see it today, especially in a down economy. People have lost insurance and don't have any. We have seen an increased number of Medicaid patients, the state and federal program to help the poor access health care. We have seen a lot of that. We continue to see it. You see more of that during a down economy.
Now, News Channel 18 first told you yesterday certain provisions of the government's health care bill took effect. Wilson says because of the size of that piece of legislation, it could be 2 to 3 years before more insured people head to the doctor's office. Now, exact numbers from the hospital's financial department weren't immediately available this afternoon. And just as a note, I also placed a call to Clarion Arnett Hospital in Lafayette to see if it was noticing the same trend. The hospital's chief financial officer wasn't in to provide that information this afternoon. Aaron Leedy, News Channel 18.